Let's give it 1 or 2 more minutes here. All right, everyone, it is 10 o'clock, so we'll go ahead and get started. I want to say good morning and thank you all for joining us today for today's presentation on behalf of the California Department of Veterans Affairs and the California Transition Assistance Program. We would like to welcome you to today's presentation on promoting healthcare for aging veterans. So we have quite a bit of information to cover today in a short period of time. So just before we get started, I'd like to go over some general housekeeping items. If you are not a speaker or a panelist, we do request that you keep your microphones off and your cameras off as well, just to kind of eliminate some of the distractions and save on bandwidth for the presentation. As far as the agenda goes today, we are going to be going over a brief overview of some of the California specific veterans benefits that are offered here in the state, as well as an overview of the California Transition Assistance Program. And then we will be joined by our guest speakers and our panelists for the Veterans Benefits Enhancements Program here at Calvet, and as well as the Health Insurance Advocacy and Counseling Program as well. So we have quite a bit of information to go over. Glad you're here joining us today, and we'll go ahead and get started. I also wanted to add that if you have any questions throughout today's presentation, you can go up on your toolbar and you can use that Q&A tab to submit your personal questions. That will allow each one of our panelists to see that question, and the appropriate subject matter expert can respond accordingly. Throughout the presentation, we and my colleague will be sending information through the chat feature, and that is just some additional links and other materials that you can view or download on your time. But again, if you have a specific question, please submit it to that Q&A tab. And then also at the end of the presentation, we'll allow some time for a virtual Q&A panel if you wanted to just wait and hold your question until the end and send it to the right person. Okay. So again, I'd like to welcome you today. We're going to begin with the CalTAP overview. I'd like to introduce myself. My name is Derek Rose, and I serve as a training coordinator for the California Transition Assistance Program. United States Navy veteran, kind of familiar with the transition process myself, as far as exiting the military, using my benefits, using for my healthcare and everything like that. So it's really nice to be able to come back and speak to you all today. So thank you for having us, and we're excited to bring you this information. So just to get started, a little bit of background information on CalTAP. What exactly is the CalTAP program? Well, it's designed to inform and connect veterans of all eras to the earned federal and state benefits, and provide those resources as needs change over time, because we know that not all veterans needs are the same. So the way that we've done that is through our pathway program, and you can see which each of those pathways are comprised of. We have everything from our core curriculum, which is essentially Veterans Benefits 101. It's how to get enrolled into the VA healthcare system. It's how to apply for disability compensation, and exactly what are my veterans benefits. And we'll be touching a little bit more on that briefly, as well as our additional pathway programs. So everything from education, employment, entrepreneurship, and our veteran service providers pathway. So if your transition is taking you into each one of those key areas or pillars, our program has learning modules for you to use to go over those resources and how to get started. So we're going to touch a little bit briefly on that, kind of how to get started and how to navigate our website to find this information. So some additional ways to connect with us if you'd like to stay informed and updated on our services and kind of stay in touch with Calvet. You can always send us an email to that email address on your screen, caltap@calvet. That way we can make sure that we have your contact information for any of our newsletters that go out, or if you want to sign up for any of our events that we have coming up, that's just a way to stay connected. You can always register on our Calvet website for personalized benefits information. You can create an account and kind of select what benefits or services you're interested in, and it'll give you all of the information regarding those. You can always follow us along on social media through Eventbrite or Facebook as well. And you can always attend our webinars and fill out today's survey that we have for you as well. So there's also some QR code images right there on your screen. If you have a smartphone, you can simply just pull out your phone and scan those QR codes, and that will bring you to all of this information as well. Also, we have all of our archived webinars throughout this our webinar series that we've been hosting, and we have uploaded those and shared those all to our website as well. So this is our main page on our website for the CalTAP program, and if you can kind of scroll down there to this yellow icon, that will bring you all of our archived webinars. So everything from healthcare information to mental health to housing to education. This webinar is recorded, and we do post these on our website shortly. So if you're able to kind of go back on your own time and you come across any other information you'd like to find more information on, all of those will be on our website for you to view as well. So to touch a little bit more specifically on some of the benefits and services that are offered here in California for veterans, I'm just going to do a quick overview. We have everything from our college and tuition fee waiver for veterans dependents of service-connected disabled veterans, which is free college here in the state of California. You can get the word veteran printed on your driver's license, so that way you don't have to carry around your DD-214 everywhere you go. If you have a significant service-connected disability that impairs your mobility, you can apply to have your vehicle registration fee waived. There are fishing and hunting licenses as well as state parks pass eligibility. California is a great place for outdoor recreational activity, so that benefit is also offered to qualified veterans as well. If you are permanently and totally service-connected disabled, you can apply for a property tax exemption through your county assessor's office. If you wanted to sell any goods or products or services and you needed to apply for a business license, you can apply to have that fee waived. Another great program is our Calvet Home Loans program, which kind of mirrors the VA home loan program as well, but Calvet actually serves as the lender on a Calvet home loan. So we have a great team that can work with veterans directly through the home buying process, and we're going to be sending out more information just if you're interested on that as well. Calvet has a great team of our minority and women's veterans division outreach programs here at Calvet as well. They just do great work to serve our underserved and underrepresented veterans here in the state of California. And we also operate 8 veterans homes for long-term care, and those are spread out throughout the state. So those are some long-term care options for veterans if that time of need does come. And also Calvet operates 3 state cemeteries. So that is just kind of a high-level overview of what you or perhaps your family could be eligible for. So just wanted to share that with you. And again, if you have any questions on any of these benefits, please feel free to reach out to us or send us a note in the chat, and we can talk a little bit more about that with you. I also wanted to highlight our California Veterans Resource Book. This is a great tool to keep handy. It really covers everything that you can imagine as far as veterans benefits, from federal benefits to state benefits, everything that I just spoke about, where your local county offices are. There's non-governmental agency information in here as well. So if you do not have a hard copy, I do encourage you to go visit our website, and we're going to be sending out the link as well to download a digital copy of this book. It really is a great resource to have for you as well. So some other websites or information that you may be familiar with is, of course, through the VA. Here's where you can go to manage all of your healthcare information, your disability claims information as well. You request your records, whether it's medical records or your military records, and actually apply for benefits as well. for example, your education benefits, or to see how much time you have left on a GI Bill or something along those lines. So VA, another great resource for you as well. So this is my personal contact information. My name is Derek Rose. You can send me an email and I'll be happy to chat with you in more detail about anything that we covered. Also, you can find us online through those QR codes like I just mentioned as well. So I know that's a really, really quick and a lot of information thrown at you at one time. But I do hope that you reach out to us if you have any questions. So with that, I will go ahead and transition over and introduce Mr. Ben Gales, who's our link, who serves the Orange County region, and he can tell you a little bit more about some of the work that he does. Take it away, Ben.
Okay, thanks so much, Derek. Good morning, everyone. Yeah, so at Calvet, I'm what we call a link. One of the most important things that we do is we provide information about benefits and services. We also make direct connections to benefits and services. We do a lot of work by phone and email, and that's certainly a way that we can help you or anyone you know anytime. Next slide, please, Derek. Okay, so this is our link map. We have 8 links in the state. This map is color-coded, so you can see what link can best serve you. We got our emails there. You can see our regions. Some are bigger than others. Some have higher veteran density. But the main point is that we all have a lot of really good knowledge about our regions. So we're in a good position to help. Next slide, please. Okay, so what do we do as links? We provide outreach to service members, veterans, and their families. We make referrals and work directly with established service provider networks. We assist with local emergencies, and we provide leadership and advocacy to local communities. Next slide, please. So we have a sampling of benefits up here that you can access. It's certainly worth noting that there's a lot more out there than this, certainly through various nonprofit organizations. The ones we have here are government programs that you'll find across the state. So the EDD, they have veteran-specific programs for employment run out of America's Job Centers. We have county veteran service offices, a very important gateway to apply for state and federal benefits. Calvet and all of our benefits that Derek highlighted. And then certainly the VA. Their medical centers and clinics, their vet centers for mental health support. So certainly a lot out there. And as I mentioned, certainly much more than this, nonprofits covering housing, legal services, specific programs for aging veterans or children and families. So as links, that's the kind of stuff that we also have a very solid understanding of. It's not just the government programs, but really anything out there that can help veterans and their families. So next slide, please. Okay, so that's it, just a brief overview from me today. But again, I think really the most important point I want to make is that please don't hesitate to reach out to us. Okay, you can certainly contact me at my information right there. If you hopefully you can get a copy of our link map that you saw with the link in every region. But this is what we do every day. We talk to veterans and their families on the phone, just about a full range of stuff. So please don't hesitate to contact us. If others could use guidance and navigation of services, please also let them know. Okay, thanks, Derek.
Great. Thank you so much, Ben, as always. Thanks again. All right, at this time, I would like to introduce our staff from the Veteran Benefit Enhancement Program. I would like to introduce Alea Franklin and Jared Stone, and they're going to speak a little bit more about this program here at Calvet, how to find more information to get started, and a little bit more about the work that they do. So with that, I will turn it over to Alea.
It won't let me do the video, but can you guys hear me? Okay, yeah. All right, good morning. As Derek said, I'm going to be telling you about the VBE or Veteran Benefit Enhancement Program that me and my colleague Jared are a part of. Next slide. All right, so Calvet has partnered with the DHCS to ensure that veterans enrolled in Medi-Cal are in receipt of all possible benefits that are afforded to them. Next slide. Based on an analysis from the Legislative Analyst Office, as many as 144,000 veterans or their dependents are enrolled in Medi-Cal. A number of these beneficiaries may not know that they are eligible for veteran healthcare benefits, which includes long-term care, potentially with lower cost-sharing requirements. It is important to note that the VA healthcare system provides care usually with a lower cost to the veteran. Next slide. So DHCS identifies veterans who are Medi-Cal beneficiaries as well as service-connected at a rate that could qualify them for VA healthcare. They're able to do this or identify them through the PARIS system, which is the Public Assistance Reporting Information System. It's operated by the United States Department of Health and Human Services, and it allows states to compare their beneficiary information with the US DVA. Every quarter, a total of 1,000 lead referrals that meet these qualifications are sent to CalVet for contact. Next slide, please. So again, along with my colleague, Jared Stone, we are the ones who will conduct the outreach. When contact is made with veterans, we will discuss information regarding VA and Medi-Cal healthcare. We also discuss benefits that may be available to them with the goal of getting them in touch with their local CVSO so they can assist with further steps. And then the next slide, Jared is going to take over for me.
Hello, everyone. My name is Jared Stone. Basically, there's 3 ways of outreach in which the Veteran Benefit Enhancement Team, Alea and myself, engage with veterans, and that is via mail, where questionnaires are mailed at the beginning of each quarter to all lead referrals that include a mailing address. Second step typically is via email. Questionnaires are emailed weekly, normally the 2nd and 3rd month of each quarter, to all lead referrals that have not responded to prior outreach efforts. And then lastly, if we still have not gotten in contact with the veteran we are inquiring about, phone calls. So during the 3rd final month of the quarter, if needed, phone calls are actually made to lead referrals that haven't responded to either outreach efforts. Next slide, please. This is what a sample VBE healthcare questionnaire will look like. This is the landing page of our email outreach. Basically, we will email the veteran, and the veteran will click a hyperlink that will go to our website. And this is typically what our questionnaire looks like, where we require first, last name, email address, which is information we obviously already have, but for organizational purposes, we ask for it again. And then you see the 5 questions with asterisks, basically getting more information of how the veteran gets healthcare, and just to make sure that VA healthcare is their primary healthcare provider. Next one, please. So there's many benefits of enrolling in VA healthcare. Probably the main benefit that us at CalVet try to push is that VA physicians are the most knowledgeable in working with service-connected conditions. They are much better equipped at answering questions regarding to a veteran and their service-connected disabilities. And they also are trained in connecting with the veteran and better understanding when that veteran served, and gauging what potential disabilities that veteran may have incurred from service. Another benefit is VA healthcare is federally administered, meaning you could go anywhere in the United States and all of United States territories, Puerto Rico, American Samoa, et cetera, and you're covered with VA healthcare. Third benefit is you can receive up to a 90-day supply of prescriptions. It can be mailed to your home. Next slide, please. So there's multiple ways to apply for VA healthcare via phone, mail. You can apply in person by going to a VA medical center and clinic close to you. And you could also apply with the help of a trained professional, whether that's accredited representatives at your county veteran service office, or as mentioned before, going to a VA facility. Yeah, I think that's it. Thank you.
Thank you both, Alea and Jared. If you all have any questions, feel free to reach out at these email addresses below, and they can follow up with you directly. One brief second here. Okay. At this time, I would like to introduce John Tan, who is with the Health Insurance Counseling and Advocacy Program. So with that, John, the floor is yours.
Thank you. I realized that I did not include any contact information in these slides, so I did put in the chat the link to California Department of Aging's general page on HICAP on how you can get in contact with your local HICAP program. So as I was introduced as, my name is John Tan. I'm the program manager for the HICAP hosted by Legal Services of Northern California, serving the 9-county region surrounding Sacramento. Go to next slide. And so HICAP is a counseling program that provides free and unbiased help regarding Medicare benefits. And that's for people on Medicare, about to be eligible for Medicare, who have general questions about Medicare, or who are caregivers, care providers, loved ones, family members of a Medicare beneficiary. And California, because we like to do things our way when it comes to alphabet soup, calls this program HICAP, Health Insurance Counseling and Advocacy Program. It's part of the statewide network called SHIP, or State Health Insurance Assistance Program. In the state of California, there are 26 different HICAP to serve all 58 of our counties. And like I said, we serve these 9 counties in my HICAP, but there are HICAPs for every county in the state. Next slide. So the way we deliver our services is through various provider networks and contracts. So California Department of Aging is the overall responsible for the program. They get the money from the feds and distribute them to local area agencies on aging. And those area agencies on aging have the option to provide services directly or subcontract with nonprofit entities, which is what our area agency on aging here in the Sacramento region has chosen to do. With HICAP counseling, all the counseling services are provided by a network of trained staff, but mostly by volunteer counselors who have gone through a long amount of training and continuing education hours and mentoring and internships to be able to provide services as counselors, as registered counselors. And typically these sessions pre-pandemic were held in local community settings, usually social security offices, senior and community centers, local libraries, any place that would benefit for having services about Medicare. We've tried to hook up with them and provide services on site. Now that hasn't been an option during the pandemic, so we switched to telephone, or at least our program and a number of programs throughout the state have switched to telephone, Zoom, Google Meet, FaceTime, whatever we could do to meet with folks and get people's questions answered. As sites start to reopen, we've gone back to certain places in the community, but it's sort of been a piecemeal approach depending on who's opening, what the local public health regulations are, and how comfortable our counselors are in going in person. But the traditional model has been in-person appointments, anywhere from an hour to an hour and a half. During the pandemic, we've increased the amount of time, and we may keep that at an hour and a half appointments as necessary. Go ahead. So who do we serve? Just like I mentioned, we serve mainly anyone who's got Medicare. So that is folks who are 65 and older, folks who have disabilities and qualify for Medicare before the age of 65, people who are about to be eligible for Medicare, and people who have general questions about Medicare. And we do work with a lot of folks who are lower income, because healthcare is expensive outside of a system that doesn't ask people to pay for their healthcare. So we work with folks who may not be able to afford premiums, copays, deductibles, and try to help them identify programs that'll help them take care of those out-of-pocket costs or reduce them significantly. We also, by state statute, work with folks who have questions about long-term care insurance, which is a private insurance product that helps to deal with the cost of aging in place or aging in a facility. Next slide. So when we think of the buckets of services that we provide, we think of them in three different things. Those are the next three slides. The main one being our counseling and advocacy services. That's the in-depth one-on-one counseling about all sorts of Medicare topics from this list. So that's how does Medicare work? What is Medicare? What are these terms like deductible and copay that I'm not familiar with? What's available in my area, whether it is about these Medicare Advantage plans that I hear on the TV about all the time, whether it's about prescription drug coverage and what CVS is going to take or what Raley's will take. How do I pay? What are these Medigap or supplement policies and how much do they cost me? How do I coordinate this cost with this care, say with the care that I get from the VA? What do I actually need to have if I'm getting my services through the VA versus getting my services at Kaiser or at a Dignity Health provider or at a local FQHC? How do I apply for government assistance programs that'll help me pay for these premiums that I can't afford? And what is this long-term care insurance stuff that I've heard about? So note that our HICAP counselors don't help people sign up for a Medigap policy or a long-term care insurance policy because there are private entities that do that and get money for it. Not necessarily being paid by the individual, but they are getting paid by someone to provide those services, and that's well beyond the scope of our services. Next slide. So the second pot of services that we draw on our services is about legal representation and referrals. So every HICAP is associated with some sort of senior legal provider, sometimes through the county, sometimes through the Area Agency on Aging, sometimes through another organization that is funded to that work. And that is to help advise Medicare beneficiaries that they do have rights if they disagree with their care or coverage, including filing complaints or filing appeals for denial of services. What our counselors are trained to do is to screen people for those issues, to help advise them on their rights, how to take advantage of their rights, and to offer to forward their case for review by the legal services provider. It doesn't guarantee any sort of representation, but it does allow for another set of eyes to take a look at stuff to see what a person could do in a situation where they're denied care. Next slide. And finally, we do a lot of outreach and education. That is sort of what we're doing here to let people know about our services. But when people, service providers, service groups, community groups ask about just sort of general Medicare information, updates to Medicare, things that they've heard of affecting their community, we go out and do a lot of these community presentations that people request. We also table at a lot of health fairs. We did prior to the pandemic. We've done sort of the drive-through health fairs, and we're starting to see these health fairs return to make sure that our communities actually get access to services that are available. We work a lot in partnership with Social Security, with the county's Medi-Cal programs, with senior centers and housing projects, medical providers, go to churches, just to make sure that people get information about things that they didn't know about or could benefit from, especially in harder to reach communities, folks with disabilities, folks who live in more rural locations in California, and then folks who don't speak English as a primary language. All right, next slide. What we rely on and what we hand out a lot during our counseling sessions is the Medicare website. So Medicare.gov has a lot of, in theory, consumer-friendly tools, which allow you to help search for prescription drug plans or search for Medicare Advantage plans, find a provider that accepts Medicare and is taking new Medicare patients now, get some quality of care ratings about facilities. That's all sort of within the Medicare.gov website. Each individual HICAP produces their own sort of consumer material. So for instance, our HICAP produces charts about the available options in the Sacramento region. Other HICAPs produce their own fact sheets regarding things like Medi-Cal, coordination of benefits, We have materials that we're constantly working on for what the options are available, how to navigate certain websites, that kind of thing that we hand out during counseling sessions. We also are a partner. A lot of HICAPs are member organizations of California Health Advocates, and they produce a number of fact sheets that are useful for consumers, some of which are available on their website, which is in the links in the chat. And next slide. Thank you for having me. I'm happy to take questions when we have question and answer. You can reach out on our website as well if you have questions for our program. And I see there's a lot of questions that I hopefully will get through while we're in the question and answer section.
Well, thank you so much, John. That was just great information. Really, thank you for your time and for being here today. That was great. Thank you. So with that, we'll go ahead and kind of transition to our Q&A portion. If you have any questions directly for anybody that spoke today, this is their direct contact information. I believe John also sent his information in the chat. So we will go ahead and open it up to our Q&A portion for those questions that came in to the Q&A. And it looks like John is maybe answering a few of those now. So we'll just give that another minute or so. So I think what would be better, John, if you are able to maybe just answer it directly, and I can read the question out loud just in case anybody has the same question. So one of the questions is, I had CHAMP VA prior to turning 65. Now I'm confused as to the type of Medicare I should have. I had A and B, and I thought I wouldn't need. So John, are you able to maybe dive into that a little bit? Or
yeah, so a lot of so CHAMP VA and another program, I know it's a different program, but TRICARE for Life, those are sort of wraparound to Medicare. So once you are Medicare eligible, whether it's because you've been on Social Security disability for 2 years or you have turned 65, both of those programs will generally advise you to call or to enroll in A and B in order to stay on those programs. You don't have to sign up for prescription drug coverage. Both of those are considered creditable for Medicare purposes, so you don't have to sign up separately. But it is a way to sort of wrap around those services and to provide more bang for your buck and for the government's buck, to make sure that the folks who should be served by these programs get as much as they need. TRICARE and CHAMP VA also provide services that Medicare does not provide. So it's more of a question of coordination. But yes, usually one of the requirements for continuing on after you become Medicare eligible for those programs is signing up for A and B. There were a couple of questions that I noticed about finding the HICAP program in your local area. I did put in the link to the California Department of Aging, at which you can go and find the specific contact in your area. You can also call the 800 number. So there's a 1-800 number that will serve you based on, unfortunately, what they do is they look at the area code you're calling in from. So if you're on a cell phone and let's say you have a 415 number but live in Southern California, they will send you probably to San Francisco, which is not where you want to be. That's why you should probably look on the website. You can also look at California Health Advocates website, which was in the chat as well, and they actually list out each of the individual counties and the contact information for each one. So that's where you can find your local.
Thank you, John.
Question about counseling Part D, since the veteran is covered under VA. It really depends on where they get their meds. So if your meds are prescribed by a VA provider and filled at the VA, Part D is not going to pay for that. If your meds are prescribed by someone outside of the VA, chances are you're not likely to get it filled at the VA. So if they get their meds filled outside the VA, it is advantageous to have a Part D plan. But because VA coverage and similarly TRICARE and CHAMP VA coverage is considered credible for Medicare purposes, you don't necessarily need Part D, and you won't suffer a late enrollment penalty if you sign up for Part D later. That's usually one of the issues is if I sign up later, I hear there's a penalty. And for Part D, yes, but VA coverage is considered creditable. So as long as someone stays in good standing with VA, they're going to be good for Medicare as well.
And then John, possibly on the question by Dwight, is Medicare mandatory if you're covered by VA healthcare system? I think we might have touched on that, but if you could just kind of recap that a little bit.
Right. So there's no real coordination of benefits when it comes to Medicare and VA. So the Medicare, VA is not going to be billing Medicare for the services that a veteran who has Medicare could get paid for, or and vice versa. So it is not necessarily advantageous or mandatory for VA, for someone who qualifies for VA healthcare services to sign up for Medicare. However, if you get services outside of the VA and you don't qualify for some of like the VA emergency coverage, then that's where some of the stuff is beneficial. Plus, if you get Social Security disability or Social Security retirement benefits, you probably also already get Part A free. You probably had enough work history. And one of the problems with canceling your Part A is if you have Social Security benefits, you're agreeing to pay back everything. Any disability benefits from Social Security that you've gotten, no matter how long you've been on the system, if you cancel your Part A, you owe back all of your Social Security benefits. Not sure why they decided to design the system that way, but that is something that has been a problem for folks because they can't afford to pay back all of their Social Security benefits. That's not possible for most folks.
Thank you, John. So one question that came in was from Kim, trying to get father-in-law enrolled into the VA, currently on hospice. Is there anyone who can help getting this expedited? I don't know about a direct expediting process directly, but you could always, if it's like a logistical matter, doing it online is often the quickest way to submit the application for VA healthcare online, and they can process that for you through their system. And again, I would also recommend reaching out to your local county veteran service office who can work with the veteran and the family a little bit more directly as far as submitting anything to the VA for processing. Our links are a great resource as well. So I know Ben shared his information here as well, but perhaps it's a matter of where you're located. So maybe we could pass along the information for your link in your area so that we could really coordinate all of those processes for you and make it a little bit more easier. So, and then John, this one's maybe even our VBE folks. In regards to getting a physician referral outside of the VA system, do you have any information on veterans maybe using their own provider outside of VA, or anybody that could chime in on that to maybe give a little bit more feedback?
Hey there, this is Jared. Could you be more specific when you say referral outside the VA system? Are you talking about a private physician that contracts with the VA? Someone wants to get a little more information on that? Because there is the Choice Act and there is the Mission Act, which are meant to help veterans who live in rural or remote areas where they may not have VA access. I would recommend looking into one of those programs to see if you can find a private physician who contracts with the VA.
Sorry, folks. Just one brief moment. What's going on here?
And then for folks who, I think I saw that the people weren't enrolled in VA or continuation of that coverage, but if someone has Medicare, the Medicare.gov website is one place where people can actually go and search for general practitioners or primary care providers or specialists, depending on how they get their Medicare. If they're just in regular A and B, they should be able to go to anyone who accepts Medicare. If they're in an Advantage plan, then they should be able to call up the plan and ask, hey, I need to find a new provider. I need to find a primary, or I haven't been able to access one in so long, or the closest one is somewhat. Those plans have an obligation to their members.
Thanks again, everyone. So with that, I think we're going to go ahead and kind of wrap up. If you have any additional questions, I know some were maybe a little bit more personal in relation to maybe specific conditions or things of that nature. So please feel free to reach out to us directly. We'll take all the time that's needed to speak with you in relation to your question. But right now, I just want to kind of highlight the webinars that we have coming up through the rest of the month of June. On June 21st, we're going to be giving a presentation on presumptive conditions related to Agent Orange exposure, and as well as Gulf War exposure as well. And then on the 28th, we are going to be going over benefits and resources to assist veterans in retirement. So we have a lot of great information coming down the pipeline for you. We hope that you follow us along on some of those websites that we mentioned so you can register for these upcoming events. Also, we would like to respectfully ask your participation in today's survey evaluation for today's presentation. If you would like to pull out your smartphone device and just scan that QR code, that should bring you right to our simple 3-minute survey. We really appreciate your feedback, and this goes a long way to make sure that we're bringing you all the most relevant information that we can. So thank you all again for your participation. Thank you all again for your service. Thank you all again to our guest speakers, John, Ben, Alea, Jared. Thank you all again. This is great information to present. Again, feel free to reach out to us if you have questions, but with that, we will go ahead and conclude. So thank you all. Stay safe, stay healthy, stay happy, and hope you all have a great rest of your week. Thanks again.